Opioids rocked households.
It was sad.
And seized people of all walks of life.
Marriage, a home, wonderful life, raising 2 sons.
Kim Humphrey, a commander with the Phoenix Police Department at the time, thought he had it all.
It was really good.
But a call about his 15-year-old son ignited distress that would span nearly a decade.
My daughter goes to school with your son, and she's very concerned that he's going to overdose.
A drug test confirmed their fear.
He comes back positive for opioids.
The struggle spiraled and extended its grip to their second son.
You know, as a parent, we're looking at this and saying we must be the worst parents on the planet.
It took Humphrey and his wife years to find parents of addicted loved ones, known as PAL, a support group.
That was the first time that we were sitting in a room full of people who understood.
The opioid crisis contributed to more than 500,000 deaths in the U.S. in 2 decades. At the epicenter, 3 major pharmaceutical distributors and manufacturer Johnson & Johnson. A years-long multi-state lawsuit led to a historic $26 billion settlement over the next 18 years. Now, some of that money is starting to come in. This year, by the end of August, 27 of nearly 50 states that filed lawsuits received a total of $310 million. Of that, Arizona received $16 million of their more than $540 million settlement. Money Humphrey hopes will trickle down to PAL, a nonprofit he now leads and is in dire need of financial assistance following the pandemic.
What we do is this peer-to-peer support. That has plenty of research behind it that it works, and it did for us.
Each state and county has a say in how the money is spent. In Wisconsin, a spending dispute temporarily blocked funds from distribution.
This is the opportunity to kind of look at, what you're doing and where you're investing money and if there are any gaps.
Sarah Whaley, a research associate at Johns Hopkins Bloomberg School of Public Health, says they put together 5 planning principles to help guide states on spending.
So 1 is to spend the money to save lives. 2 is to use evidence to guide spending. 3, invest in youth prevention. 4, focus on racial equity. And 5, create a fair and transparent process.
And adds that the settlement includes basic payout guidelines.
There are things like broadening access to naloxone, or increasing the use of medications to treat opioid use disorder, enriching prevention strategies, improving treatment in jail.
Treatment desperately needed as fentanyl fuels deaths and overdoses. With a holistic and smart spending approach,
Somebody here gave me this frame, Family is Everything.
Humphrey hopes families can find the peace they've now reached. Both of his sons are now clean. Humphrey tells me he is closely monitoring any indication that this money will be dispersed and when nonprofit organizations can apply for it. Now, we did reach out to the Attorney General's office. They have a plan, a spending plan, but when that money will be dispersed, we're still waiting to hear back. Alex, Jay?
All right, national correspondent Addie Guajardo reporting live for us from Phoenix. Thank you so much.